Who is considered the founder of modern nursing? Correct answer is option C. Florence Nightingale. A nurse is providing care that is below the standard of practice. This is an example of. Correct answer is option B. Negligence. A patient blood pressure reading is 150 over 95 mm of mercury. How would the nurse classify this? Correct answer is option B. Stage 1 hypertension. The most appropriate site for measuring a core body temperature is. Correct answer is option B. Rectum. A pulse deficit is identified by. Correct answer is option A. Comparing apical and radial pulse rate. During a head-to-toe assessment, the nurse uses a stethoscope to listen to lung sound. This technique is called. Correct answer is option B. Osculation. Capillary refill time is a test for. Correct answer is option A. Peripheral circulation and hydration. Which is the most effective method to prevent the spread of infection? Correct answer is option B. Hand hygiene. Transmission-based precautions for a patient with tuberculosis would be. Correct answer is option C. Airborne precautions. To ensure safety when ambulating a patient, the nurse should. Correct answer is option A. Use a gait belt. When providing oral care to an unconscious patient, the nurse must prioritize. Correct answer is option B. Preventing aspiration. To prevent food drop in a patient and prolonged bed rest, the nurse should. Correct answer is option B. Use a footboard or high-top tennis shoes. A wound that is open has minimal tissue loss and is clean is healing by. Correct answer is option C. Primary intention. Which type of dressing would be most appropriate for a wound with heavy exudate? Correct answer is option B. Alginate. When describing serosanguineous drainage from a wound, the nurse is referring to a fluid that is. Correct answer is option C. Pale pink and watery. The rites of medication administration do not include the rite. Correct answer is option C. Diagnosis. The Z-track technique is used when administering. Correct answer is option B. Intramuscular iron. Before administering any medication, the nurse's most important assessment is. Correct answer is option B. The patient's allergies. A patient with severe vomiting is at greatest risk for developing. Correct answer is option B. Metabolic alkalosis. The nurse assesses pitting edema as +2. This is characterized by. Correct answer is option C. A key sign of dehydration is. Correct answer is option C. Tented skin turgor. The preferred position for a patient with difficulty breathing is. Correct answer is option B. High fallers. The pulse oximetry reading is considered within the normal range for a healthy adult at. Correct answer is option D, 95 to 100%. To facilitate insertion of a nasogastric tube, the nurse should instruct the patient to. Correct answer is option B, shallow sips of water. A patient is experiencing constipation, the nurse should recommend increasing intake of. Correct answer is option B, fluids and fiber. The primary goal of aseptic technique in nursing is. Correct answer is option B, prevent infection. Which position is most suitable for a patient with dyspnea? Correct answer is option C, high Fowler's position. Which is the primary reason for nurses to use gloves during patient care? Correct answer is option C, to prevent cross-infection. Which type of wound healing occurs when the wound edges are brought together with sutures? Correct answer is option B, primary intention. The best way to assess dehydration in elderly patients is by. Correct answer is option A, checking skin turgor.